We've heard a lot about virus variants. We also heard just a moment ago that there's a surge across the country. But what makes those variants more contagious than others? Dr. Nicholas Testa joins us now to help sort out some of the latest information. First off, welcome once again, Dr. Testa.
Thanks, Phil.
So when we start talking about the variants, and a lot of people have the vaccine already, is it going to protect you? Is it going to lessen it if you get the variant? How does that work?
Yeah, that's a super important question, and it's hard to answer definitively because things are moving so fast. Right now, we are seeing more variants. The one that's most concerning is the one out of the UK, which we have seen is not only spreads faster but has a higher mortality rate. Right now, preliminary data looks like the current vaccines that are out there prevent the variants. The challenge is that things are still evolving so quickly that we are always at risk for a variant arising that outsmarts the current vaccines. And that is why it is so important that we continue not only get vaccinated, but continue social distancing and all the other good measures that have really mitigated the spread, because the less that virus is reproducing, the less likely we are for that variant to show up that outsmarts the vaccine.
Well, now you talked about the UK variant. Why is it more contagious? Do we know?
To be honest, I don't know the answer to that, and I'm not sure science knows the specific answer why it's more contagious. I will say that whenever a virus pops up that is new, it tends to harbor characteristics that our body hasn't seen before, hence it can spread and be more lethal. But that's really more speculation than anything else. We're still trying to figure out what's going on.
Well, the good news as we talk is that schools are starting to reopen. But what are the needs, the things, I should say, that parents need to pay attention to keep everybody safe?
So there's two main things that are going to happen while schools reopen and we wait for kids to be vaccinated. One, masks are going to be mandatory and social distancing is going to continue. Now, fortunately for school-age kids, they follow direction really well, frequently better than adults. So you can anticipate when your kids go back to school, they're all going to be wearing masks, and there's going to be all sorts of strategies to keep them socially distant. Now, that could either be having staggered schedules or having your kids in pods so that they only interact with the same group of kids. And then the other thing that is going to be present is testing and screening. So we can anticipate that almost all kids are going to be tested weekly while they're in school. And then when they show up to school, that there is going to be some basic symptomatic screening as well as some objective temperature screening.
Well, now you mentioned a moment ago we're going to need to keep a lot of our protective measures in place, but there will be those who get a vaccine and think, I don't need to wear a mask anymore. But we've already heard you do need to keep wearing the masks. Why is that so important?
So as we talked about in the beginning, there's still a lot of unknowns. We can speculate that the vaccine is going to not only decrease the severity of disease, but the transmission of disease, but we're just not sure. So there have been asymptomatic carrier states all through this COVID epidemic or pandemic. So there is still an assumption that even if you can be asymptomatic, you could still be spreading the virus. So the recommendation is while we're out in public, we still wear a mask, we still socially distance. I will also arc back to the first thing that we said with these variants arising, we don't know which one is going to outsmart the vaccines that we have. So the only way to prevent that is through all those good precautions that we've taken to heart, which is wearing the masks, social distancing, and so on. So while we're in public, even for those of us vaccinated, we need to continue doing that stuff.
Okay. Dr. Testa, thank you very much. Dr. Nicholas Testa, Chief Medical Officer, Dignity Health in Southern California. Thanks and stay safe.
You too, Phil.
Okay, when we